Okay. Oh. Here we go. Okay, so today it'll just be a short session, 20 minutes to half an hour. There'll be a short introduction from Misha, and then I'm going to give a demonstration of the Victorian Women's Health Atlas that we've been developing for the last few months, and then there'll be a chance to ask any questions at the end. And if you're online and you're at your computer, you can actually play along with the website as Katie's demonstrating as well, so you can actually have a go at playing with that. So thanks everyone for coming today. We're really excited about the Victorian Women's Health Atlas. I'm Misha, as I said, Policy and Health Promotion Manager at Women's Health Victoria. We've got Katie here. We've also got Emma Dardick, who was the project manager for the at Women's Health Victoria when it was being developed. She's our data guru, and I will be throwing data-related questions Emma's way at the end. I wasn't actually around at Women's Health Victoria when this project was underway. I just got to be there for the AGM when it was launched after me. So it's actually lots of other people, in particular Katie and Emma, who've done all the hard work to get it to where it is today. But yeah, Women's Health Victoria are really excited about the Health Atlas. It was launched by Minister Hennessy, Minister for Health, at our AGM. And we think it's a fantastic resource for all women's health services and for other community organisations, local government, the broader community, to understand the gender impact of the gendered health impact. This is, I understand, the first resource of its kind at least in Australia. Well, can either of you confirm that? Where to have that kind of gendered data by LGA, I think that's what's really unusual about this, is that we've actually been able to gather together a whole lot of data by local government area, which makes it a really amazing resource for local governments to be able to look at specific issues in their area and be able to deploy it in terms of policies and urban design and all sorts of things. So that's why we think this is a particularly unique and useful resource. It makes clear, I think, when we'll see this when Katie gives us a demonstration, some of the stark differences in the health experiences and outcomes of Victorian men and women in different parts of the state. I think some of the data probably confirms what we'd expect certain differences to be, but in other cases it can be quite surprising as well to see which LGAs have better and worse sort of health outcomes and where there are particular gender disparities in particular outcomes. So I think Katie's going to take us to the indicator on perceptions of safety, which is a really interesting one around the differences for men and women across different LGAs for that one as well. So basically, I'm not going to talk for long, just to say that this basically is a resource that provides reliable data for evidence-based planning for local governments, for state governments, for women's health services, and a range of other organisations, and we're really proud to be hosting it. And yeah, we hope this is a useful session for you and that everyone will be able to use it for their own purposes. And we hope to be able to develop it over time. We'll probably need some additional resourcing to do a lot more further development, but certainly we'll be updating the data as new data sets become available over time. And there's potentially, there's potential for future modules, for example, to be able to show trend data or that kind of thing. Well, at the moment, it's sort of point-in-time data. It's always been able to show at this point, but there's lots of potential for it in the future as well. So, take it away, Kate. All right. So, we will jump into the Atlas. So, the Atlas is a web browser base, and we've made it compatible for all current browsers. So, that's the last 2 years. So there's already been some feedback that it hasn't been compatible with iPads. So, yeah, it's compatible for the latest browsers. I'll just put that in there now. And people can update their software, is that right? So they need to update to the most recent version. Yeah. So here it is. The URL www.victorianwomen'shealthatlas.net.au. Oh. Here it is. So this is a home page. So we've got a little introduction, and then we have it has 4 priority health areas. Now, when you select When you select a priority health area, it will then scroll down the page and show you all the indicators and measures that have been produced by Women's Health Victoria. So there are 4 priority health areas, there are 28 indicators and then 48 measures within this website. So it's quite rich in data, and then you can just scroll up. We've got a little narrative as to why each of these priority health areas is a priority health area. But what we'll do is we'll jump straight into the violence against women, perceptions of safety, which is the indicator, and then the measure is the percent of people who feel safe when walking alone. So this then takes you into the atlas page. You need to choose your indicator before it brings up the actual atlas. So what we've got here is our map of Victoria showing all the LGAs. Here's a list, that's our priority health area, indicator, measure. It's always going to be laid out in that order. We have narrative on the side here that provides the contextual information as to why this has been chosen, why the gender lens is important, and then how this indicator has been derived, just to give you a bit more information of what you're actually seeing. We also have listed the source, the currency. Lots of it is the latest ABS data, and obviously when that gets updated, this will get updated. So you always know what information it's being drawn from, and then you can always link directly to the source data if you wish. The map itself here, so we've got these buttons here, female and male. So at the moment, this is the symbology is based on traffic lights. So LGAs that are doing really well above the sort of state average, and those who are just a bit below the state average. So we've gone through every indicator and chosen those separations based on the data. So if we actually flick between female and male, you can suddenly see that gender impact between, in this one, how females feel less safe and males feel safe. Oh, my mouse. I'm going to give you a pad. Maybe. Oh, I don't know if we... Now I've lost my mouse. So that's a really good representation that probably a lot of you haven't been able to see before, just that impact. There it is. So if you want to actually understand what this data is telling you, we can select an LGA. That's now highlighted in orange, and we've got the actual statistic for the female and the actual statistic for the male, so you can have that comparison. And it has also highlighted it in this bar graph. So this graph shows, thank you, all the states, all the LGAs in the view. You can also select the bar graph on this chart, and then you can see how that has now highlighted to on here, and so you can then come down to the lowest as well, and it's actually highlighted its Brimbank. So we can't see the metropolitan area too well at this state level. So what we've also got are these zoom layers. So if I select metropolitan, it automatically goes to the metro area. And again, and the chart below then filters to all those LGAs that are in view. So again, now I can click on the lowest and it still highlights Brimbank here. And again, we have done this for all regions. So if you select the region, then there's a drop down and you can choose your region, and again highlights that area. And this graph then has then filtered to the region's LGAs. So you can compare it at any scale. And I'll just flip to male again so you can see that comparison. An additional feature is this View More button. So what this actually does, it then shows you, so this is the indicator, perceptions of safety, and then it gives you the statistics again for that measure, and it also provides the state average. This particular example, there's only one measure to the indicator, but there are some instances where you'll have multiple measures to an indicator. So STI notifications is an example where you'll have a count and a rate, and you'll have both of those listed in this table here. And then what's really a key sort of feature of this atlas is the development of a fact sheet. So a fact sheet has standardised the text, it's a standard format for the priority health area of an LGA. So I'll click on this one. So this is for Brimbank. So this is now a fact sheet for Brimbank on violence against women, and it details all the indicators and measures for Brimbank. So here we go. I might just make that a bit smaller. So this has been generated for every LGA of every priority health area. So this is a really good document that you can put in your advocacy and in your health, so that health planners can put it in their plans. So we've got all the text about why the priority health area is important, details about the indicator, and then again how the measure was derived. And in this table we have the LGA's value, the region's average if you need to compare it within your particular region, and then also the state average, and then the non-gendered state average. So that's sort of comparing where both genders should be, oh, well, I don't know if they should be achieving, but it just gives you that information. So you can scroll down and you can see a number of pages. So here we've got our incidences and then our rates.
Can I ask, so if you went through any one of the things within the violence area, you would get that same fact sheet would come up for that LGA?
Correct, yes. So it's been standardised across.
Each of the priority areas. Yeah, so that includes all of the indicators and measures.
But what you can actually, because it's actually a new page for each indicator, so if you were only interested in one indicator, you can still print it out and just use that page. I guess this footnote, just what's important to know, that footnote, that's the date that they were last produced. So any changes to the template or any changes to the database that this atlas refers to, it will produce new fact sheets. So I must have done an update on Monday. I think but anyway, so that date will stay the same because we wanted to make sure that it's not going to say today's date because it wasn't produced. It's not live data. It's not live data. So yes, there's one of those for every LTA. I don't close. Yes. Okay. So to change an indicator or a measure, you can click anywhere on this bar or banner, and it produces this selection. So then you can choose, and it will build these panels. So if we look at anxiety and depression, and then you can choose if you want to see the female or male. So we'll see male. Sorry, female. And again, so here's our legend, and you can flip again between female and male. You can zoom back out to the state, and then this is where you can really interact with the website. If you'd like to make the map more prominent, we have our expand. So, and then you just get the map.
Compare it with South Australia.
No, but if you need to if you want to use the picture in a document, then you can screenshot that image if need be to put in a presentation. So it is important. So the symbology we've used, the colours, they're standard. We've generally got the green, amber, red. So it's important to actually read the legend to understand what they are. Obviously, each indicator has a completely different range, so we needed to customise that. So just always be conscious of what those minutes are. So for gender demographics, we've used, because there's sort of no, it's factual, we've just split it into 5 quintiles. So between the male and females, we've just broken it up into 5 equal proportions, and then use those quite neutral colours because there's no, you're not aiming to get anywhere. So that is the atlas. We also have, you can always go back to that home page if need be. We've got an About Us page, just tells you some basic information. And we also just have, sorry, let's just go away. We also have some disclaimers here, so just about the use of the data, about how it was derived. So, are there any questions so far about the atlas?
In terms of updating the data, is that something that Untitled Victoria will continue to do? Or?
Yes, that's the intention.
Yeah.
The funding for this project has ended, so that's something that we need to find resources for. But the actual updating of, because a lot of it's from the census, so it's once every 5 years.
Yeah.
That's hopefully something that we could potentially take a contractor on, for a few weeks just to do the update. It's not necessarily an ongoing project, but yes, at the moment, it's something that we're having to find resources for internally. Yeah.
We do have a process here that if data is provided, we can easily include it. I think that was Reese's intention.
Yes.
Hopefully, this is a starting point and it can
yes,
grow.
obviously, as soon as that data is out of date, this becomes a much less valuable resource. So certainly keeping it up to date is a priority.
And the intention was as well to keep this baseline data and then build on from there to snap trends as well over time.
Yeah, that was my next question was, so for example, chlamydia rates, can we see what the last 5 years was, or is it only the current?
Not at this point. So this is just the current snapshot.
Yep.
But yes, the intention is that when we have the next year or the next 5 years, whatever the date range is for the next data set, that will retain this as the baseline, and then we can start to build the trend.
Yep.
But that would be a new kind of module to add to this. So that's something that we'd need additional resources to actually be able to show on the screen, but we'll certainly keep the data so that we can build that when we have to.
Thank you.
Yeah.
I had a question about if we had a query about data, would we talk to Untitled Victoria or to?
The About Us page, which I am going to update, has who to contact.
Okay.
At the moment, we've got Reese's contact details there, but there's actually a communications email that I'll
so it's
put on
basically
there.
communications@whb.org.au, and we'll monitor that, and we can respond to any queries, technical stuff, or obviously refer to Katie, but in terms of questions about why we chose particular indicators or that kind of thing, we can field those as well.
Yeah.
Just got one comment, because I was here for the first phase of data testing into the personal stages, and all the suggestions we made have all been incorporated, and it's really fabulous. I just think it's good, and it seems to reveal the data really easily and simply, and looks easy to use. I think it'll be fabulous. We just need more data to be broken down by LGAs. Put pressure on people.
Yes, so someone I was talking to the other day said, it actually gives us a tool for advocacy as well, to actually say it would be great to have this data set by LGA and this data set and that kind of thing. So this demonstrates the value of having that kind of data.
Yeah, the traffic light system, the greying out of the other states and the prominence of Victoria, all those things, fabulous.
Yeah.
Remember all our list of wishes?
Yes, I definitely do remember those lists.
Yeah, the fact sheets by LGA are fantastic. It's going to save us a lot of work. Definitely.
Yeah, no, that's great.
All right. So I guess I've just did this. This might be a nice little reference slide for you, just a little summary. So yes, I just wanted to reiterate the priority health area indicator measure, so you always know what you're viewing. These buttons, the blue is what you have selected, and you can always zoom, choose your male and female. Yeah, so that's just basically what I've just gone through, but I might send this out so you can all have a little cheat sheet when you need. Something I did miss. When you change between male and female, this chart reorders in ascending order, so it's always the lowest to the highest, so that, yeah, it does change, but it's quite good to represent, again, show that difference between male and female.
Were there any other questions or comments, feedback?
In terms of my question is delivering training next week.
Yeah.
Split between men and women, both involved. Copyright. So as long as we acknowledge the source and we stick a slide in with it.
Yeah, I would have thought so. To be honest, I haven't thought about that. But yeah, I mean, it's all publicly available data. We don't have any copyright over the data. But yeah, I mean, if you're showing a slide from the web page, yeah, probably Victoria is appropriate, I guess. Yep.
On there, because people are
that's what I think. Yeah. Good question. All right. Was there anything else? No?
No? Well, thank you.
Yeah, thank you very much for coming in. I know it's
questions, have we?
Sorry, any?
Anyone typed anything in the chat?
I don't. Oh, I hope not.
Perhaps it will come up. Oh.
No.
I think it looks great, Katie.
Thank you. Thank you.
Oh,
Thanks for joining us online.
Been there from the beginning, and it's really developed and evolved. I think it'll be excellent. I think it is excellent.
and with the comments and questions, we do welcome positive comments and feedback as well. Just like that.
Thanks for joining us online. When do we think that the web version will be available?
As soon as I press stop.
Fantastic. So we've got to get it on the website
Yeah.
pretty shortly. Great. Okay. Thanks, everyone.
Excellent.
Thank you.
Thank you.